Good afternoon, everyone. So delighted to see such a full house on such a important issue for this master class. My name is Jim Saylor, and I'm the co-president of the Population Council. And on behalf of myself and my co-president, Pat Vaughn, and the Pop Council, it's my pleasure to welcome you here to this master class. I'd like to start by thanking SheDecides for inviting us to co-host this event. The Pop Council has been a SheDecides champion since its inception, and we're grateful for their steadfast efforts to ensure that sexual and reproductive health and rights remains on the global agenda, especially in what we all know are these exceptionally challenging times. The Pop Council is a SheDecides champion. I'm also a SheDecides champion personally, so I'm going to put on my SheDecides lapel button here as well, because we should all advertise this loud and long. It's a very proud association, and we really, Pat and I both appreciate that you asked us to be champions, and of course, we're delighted to do so. I'm also thrilled that Nina Brandt is here, Chief of Partnerships, Advocacy, and Communication from the UN Youth Office, who will be able to provide important context and framing for this session. And Hannah Mulugeta, the Vice Chair of the EU Youth Sounding Board and Youth Country Coordinator for a really great named organization right here, right now, Ethiopia, is here too. During CPD, Hannah spoke at the Pop Council about how to position youth SRHR as core to development progress. And I'm very glad to have you back for this discussion. For those of you who don't know the Population Council, we're your hosts. We're an international research organization that has been working for nearly 75 years to ensure that development programs and policies are based on data and evidence. And for 70 years, we've been developing technologies to ensure that women, for sure, are able to exercise their own choice, including the Mirena and the Copper T and the Norplant and Jadel implants. In the program and policy area, our colleagues and researchers were among the first to make the case that investing in adolescents, in particular adolescent girls, is not only the right thing to do, but it's also the smart thing to do in order to advance the local, country, and global development agenda. That advocacy and that interest and that spurring began 30 years ago. And today, the central question about investing in adolescents is not whether or why, it's how and when. When in the girls' age, it's smart to do so. In response, the Pop Council has built the world's largest body of evidence on what does, and importantly, what does not work to enable adolescents and young people to reach their full potential. We've made the essential argument that adolescent girls are not a homogeneous group, whether in or out of school, living in urban or rural settings, married or unmarried. Girls need tailored approaches to meet their complex needs. In Ethiopia, council programs like Baru Tesfa, which means bright future, were among the first to highlight the isolation and vulnerability of adolescent girls and young women engaged in domestic work, which is a really important population there. Running for almost 20 years, the Baru Tesfa established safe spaces groups for out-of-school migrants and domestic workers, leading to lasting positive impacts on use of health services, literacy, friendship networks, and mental health, and demonstrating that it's possible to reach and empower even the most marginalized girls. We have a lot of evidence. You can look it up. In rural Wajir, Kenya, where 1 in 4 girls are married as children, we developed a multi-dimensional program to successfully bring girls back to school or to attend school for the first time ever and delay child marriage. By developing an intervention that addressed multiple needs, including, because you can never just do it with one element, right? You need to address a wide range of needs, community norms, education, household economy, health, life skills, and financial literacy, we saw positive results with impact sustained well beyond the end of the program, which is always a key measure of success. This has prompted the local government to adopt and scale up the model across the country, and there's now interest in expanding the program more broadly in Kenya. Leveraging this expertise, we established the Girl Center, and the Girl Center is an acronym, and it stands for Girl Innovation Research and Learning, or Girl Center. We established the Girl Center in 2017 to bring together and amplify our extensive work on adolescence. The Girl Center synthesizes research across countries to extract learnings that can be applied across settings. It prioritizes data accessibility, and it creates user-friendly tools to inform policies and programs and promote evidence-based decision-making. Importantly, the Girl Center emphasizes that data and evidence must be generated by and with adolescents, ensuring that they are active and meaningful participants rather than simply recipients of efforts to shape their lives. And for all these reasons, I'm very pleased that Evalin Karijo, the Girl Center's Associate Director for Policy Partnerships and Engagement, has come all the way from Nairobi to be here with us today to speak at today's masterclass. Evalin is not only going to provide the evidence on adolescent SRHR, she's also going to inspire us to action. So we'll look forward to that. And if you haven't met Evalin yet, you will understand that comment by the time you're done today. First, I'm really honored and privileged to welcome Karin Nilsson, the Executive Director of SheDecides, who is a source of my pin and all the champions and a tremendous amount of fantastic work on behalf of girls and women globally to introduce today's program. Karin?
Thank you. I feel a bit small. Can you see? Thank you so much, Jim. Thanks for the warm welcome. It's lovely to be here with you today. Thank you for the partnership. Thank you for championing and for driving change through research with all the amazing work that Population Council is doing every day. We're so excited to focus on our speakers and to learn from you today. And we're grateful to be here at Population Council office. And I want to say warmly welcome to all of you in the audience. I hope you're feeling okay. How are you doing? Are you alive? Yes. Thank you for taking your time. This very intense Unga week. It's really pressuring times, challenging times. So we appreciate you coming together to focus on how we can learn from each other. We are today going to focus on how data can drive action. As you said, Jim, we're excited to hear from Evalin. And we're also here to learn what evidence on adolescents, SRHR, and the SDGs will tell us. So my name is Karin Nilsson. I am the Executive Director of SheDecides. And for those who don't know what SheDecides is, I'm here with Karin, who is the Champions Advisor, who's the mastermind behind the Masterclass. Please give a shout out to Muriel, who is the Policy Advisor at SheDecides. Together, we are part of structuring, helping, and supporting SheDecides champions. And thank you so much for championing choice and rights and evidence-based, evidence-driven action with research with Population Council. SheDecides is a global movement taking political action so that every woman, girl, and young people in all their diversity can make the choices that they are supposed to make. They can make their choices about their lives, their future, and their own bodies. And we are a convener of game changers, experts, and leaders in general quality, health, and human rights. Our champions include governments, ministers, civil society organizations, service providers, youth leaders, researchers, media, and donors from across the world. We unite as a diverse and intergenerational movement to drive progress for bodily autonomy and sexual and reproductive health and rights for all. Our champions are at the heart of the whole movement, and I see several of the champions here today, so thank you so much for your important work. We come together with the different areas of expertise, and we think now more than ever it's important to learn from each other, to help each other, to support each other with the different roles and capacities that we have, to strengthen action and to advance. So I'm privileged and honored to be here with you today, the SheDecides champions and allies in all your formats and diversities and different areas of expertise. We come together and we take change and we lead change together. We often hear that the opposition is powerful and well organized, but so are we. And we have a wealth of knowledge, expertise, and power within our pro-choice movement. The Population Council is transforming global thinking on critical sexual and reproductive health and rights issues through research, and was, as you mentioned, actually the very first research organization institute that joined SheDecides. So we deeply appreciate your expertise. Thank you for all your work. Research is essential to all of us to inform global commitments, to hold governments to account, to measure what's working and not, to ensure that we have a sustainable development for all, and that the sustainable development goals will be achieved. Research and data also provide, of course, the evidence we need to counter the anti-rights and anti-gender, and for also the anti-science community in terms of pointing to facts and pointing to research and evidence that will inform decision-making to counter the misinformation, particularly when it comes to sexual and reproductive health and rights, which are at the heart of the development and gender equality for a sustainable development for all. So with that, I'm not going to be lengthy. I just want to tell you that Masterclass is a series of events that we're organizing together with our champions and allies. We think it's important to learn from each other to strengthen the movement and build capacity, particularly in changing times. And we're really delighted to do that together with you today. We've heard the presentation of our speakers a little bit, so I'm not going to go into details. You can see that we clearly coordinated in color down here. You might notice that it's the color of the SDG 5 goal. It's all thought through. But of course, we're standing up for gender equality for all. And in that, you need to make sure that young people and adolescents in particular will be given the choice and the chance and the information and the services that they need and they ask for and have the right to. So proud to introduce and leave the floor to Nina Brandt, the Chief of Partnerships, Advocacy, Communication at the UN Youth Office. Welcome. Thank you so much for being here. Over to you.
Hey everyone, can you hear me? I'm a little bit taller. You let me know. But I'm so excited to be here. Thank you so much for coming and filling the room in this very busy time. And thank you, Jim, also for your warm welcome. I'm very happy to be here, and I'm excited to join the Population Council and others in this very important event. And thank you for your longstanding efforts in advancing evidence-based advocacy. This is a historic week at the UN General Assembly. I don't know how many of you have been across the street, or yeah, I see a lot of nods. So we're very excited about this. And you may know that this is the first high-level meeting on youth that ever took place. It's going to happen on Thursday, and our office is organizing it. So we are really excited. We're going to be spending a whole day with heads of state, ministers, civil society, youth leaders, and discussing the important youth agenda. So just wanted to say that this is such an important moment where this masterclass is happening. And it's really good to be here and being part of this movement. As you all know, this is a moment of extreme geopolitical tensions and crises. We are past the midpoint of the 2030 agenda, and progress is off track on more than 80% of targets, which with nearly 1/3 stalling or regressing. Inequalities are widening. Young people, women and girls, and marginalized communities are among those left furthest behind. And crises like conflict, climate change, and the cost of living are compounding setbacks. But they also show why the SDGs are more relevant than ever. Yes, the SDGs remain the only universal roadmap for peace, dignity, and sustainability. And we need urgent acceleration and political will. At the same time, young people everywhere, often the ones that are left behind, are the ones who step in as first responders, peace builders, innovators, and finding solutions, even in the most challenging of circumstances. So as we prepared for this historic week and this historic meeting on Thursday, we wanted to make sure we hear directly from young people about their priorities and their visions for the future. Through the youth lead dialogues, we engaged more than 75,000 young people in 182 countries who shared their realities, their priorities, and their vision for the future. What emerged were three clear priorities: decent work, education, and health, including mental health. Young people are asking for stigma-free, youth-friendly systems that are accessible to all. In this envisioned future, no one worries about affordability when seeking care, and information is shared in ways that foster trust and open dialogue. Well-being is seen as a collective responsibility supported by communities and institutions alike. And I want to call one young person from India who wrote, "In the future, I imagine young people are not seen as future leaders, but as co-creators of the present. They grow up in communities that center care over control, access over exclusion. Schools teach empathy alongside science. Health systems adapt to every body and mind. And every young person, regardless of disability, background, or identity, is trusted to shape solutions, not just react to problems." So interestingly, when young people talked about these priorities, they clearly articulated the important intersections between them. They didn't see education, decent work, and health in isolation from each other. And this is why the SDGs matter so profoundly to young people. These goals aren't separate silos. They are deeply interconnected. How can we achieve gender equality without ensuring access to sexual and reproductive rights? How can young girls get the education they deserve if they don't have access to comprehensive health and decision-making power over their own bodies? We've made significant progress over the past 30 years, but we are still far from fully realizing the SDGs by 2030. Young people have been warning us about this gap, demanding accountability and often their ideas, voices, and solutions to close this gap. And this is precisely why meaningful youth participation, which is really at the core of the work of the UN Youth Office, must be at the core of accelerating progress. We cannot build the future young people deserve separately from them. Young people must be at the cornerstone of decision-making, crafting policies and solutions that make sense for their own futures. And if we want to see real advancement, we need scaled-up investments and to properly resource innovative approaches rooted in intergenerational collaboration. The evidence is clear, and we will hear more about that, I'm sure. Investing in young people's well-being and in their meaningful participation in decision-making generates returns across a range of development indicators. More importantly, it builds the foundation for the just and equitable world we all want to see. I have a sticker that I found today because I put together a little well-being corner in our office. And the sticker says, "The future starts today, not tomorrow," which is really the mantra of what we believe in our office. And that's, I would like to hand the floor to a remarkable young leader who is one of our 12 sponsored young leaders from the UNGA this year, and who is walking the talk on connecting grassroots actions with global engagement. Hannah, the floor is yours.
Feels really good to be back in this room, especially today to talk about that. It's really close to my heart. I have to speak louder. Definitely, I can do that. And closer, right? Yeah. Okay. So I'm going to speak about why sexual and reproductive health and rights is very crucial for young people. And I want you to start thinking about the decisions that you make every day. Decisions like what kind of clothes to wear today, to start a job tomorrow, or to leave the job that you're in right now, to start studying, to move, to travel, to, these basic decisions that we make every day by day, to stick to a milestone for ourselves and to make our lives better. And those the lives of those around us a little bit better than we have it today. And I want you to imagine being told that starting from today, you cannot do that. It's a choice that you cannot make for yourself. It's a choice that somebody else, government could be, those that are really older than you, or anybody that's in power than you, can only make for you. This is the reality of millions of young people that they face, that when it comes to their sexual reproductive health and rights. Sexual reproductive health and rights is more than health. It's power, it's dignity, and it's freedom to shape one's life. It's the girl in Ethiopia that managed her period with dignity and no longer misses 4 or 5 days of class because she cannot access her menstrual hygiene kits. It's about the boy in India who learns how to regulate his emotions to be a man who knows consent and respect. It's the young Brazilian who resists peer pressure around drugs and risky choices, now contributes his energy to, I have to be closer, contributes his energy and skills to his community. It's the Kenyan girl who understands her body, gaining confidence to dream bigger and walks with courage. It's the girl in Afghanistan who should live free from gender-based violence, free to choose her friends who can lift her up and walk safely in her own community, because safety is the foundation of dignity, and dignity is the beginning of opportunities. Sexual reproductive health and rights is not just health, it's choice, it's freedom, it's possibilities. The evidence is clear. For every dollar invested in adolescents' health, the return is more than tenfold. It comes in stronger family, healthier communities, and more resilient society. And to fail to invest on adolescent health comes in costs that are very irreversible. It comes in wasted potential. It comes in broken dreams. It comes in futures that are not going in the right track, and promises left unkept. So without SRHR, poverty reduction stops. And when it comes to unplanned children, you can see that there's a lot of poverty that would come into those lives. This is SDG 1. And without sexual reproductive health and rights, hunger deepens for every young person that fall in the traps of early age misguided decisions with lifetime consequence. And without SRHR, schools lose students every month due to menstrual cycle stigma. Without SRHR, gender equality fails. That's SDG 5. Without SRHR, economies weaken. That's SDG 8. Without SRHR, justice is denied to gender-based violence survivors. That's SDG 16. So SRHR is not just one target, it's the backbone of the 2030 agenda. And why is SRHR crucial for young people? Because it is the foundation of our choice, our safety, and our future. Thank you.
Yes. Thank you so much for sharing that. It's crystal clear. Of course, evidence speaks its clear language, but you also speak your clear language in terms of pointing out why it really matters to have the freedom and the choice to plan for your life and live your life as you want to live it, and have the opportunities. And with that, I am really happy to introduce to you. You ready? I'm getting ready. We are really delighted to welcome you, Evalin, to share your expertise and to learn more about the Girl Center, and also really to look into when you root decision-making in evidence, when you listen to what young people, to your experience, to what young people can contribute with, driving solutions, having their youth-led expertise, we can clearly see amazing results. So over to you, and warmly welcome, and thank you for sharing your knowledge. Thanks.
Thank you, Karin. I hope this is clear. I have to stand there so that we can adjust it. Thank you for that warm welcome. Okay, see a few notes. I'm so excited to take on this next segment of the masterclass and to share reflections from the Girl Center, which Jim has talked so wonderfully about. And of course, too much gratitude to all the previous speakers. You've talked so well about the SDGs and adolescents here, SRHR. So I'm going to build on that. So really excited for this. I have spent most of my career working with adolescents and young people in low and middle income countries, especially in Africa. And I have seen firsthand the progress that can be made when we are intentional about investing in adolescents. And so I'm really honored that I'll get to share a few of those reflections. As the Growth Center, we are also very honored because we've taken conversations on adolescents' well-being, not just at local level, but also at regional level and global level. Last year, we collaborated with the UN Youth Office to co-lead one of the impact coalitions at the Summit of the Future, the Adolescents and Youth Impact Coalition. And we're not just by ourselves. We had many organizations working with us who were with Women Deliver. I know they're represented here, MDCY. And so we really convened and had conversations on adolescents' well-being, elevated not just at regional level, where we had, the CSO conference in Nairobi, but also at global level here at ANGA last year. So for us, it's really a great pleasure, and I'm happy to get to share some of those insights today as well. So I want to start you off with a quiz. I know Hannah has given you a tip for this. And she was speaking, I was like, okay, there's the scoring sheet. But I want to get your view on the SDGs. Which SDG do you think has the strongest linkage to adolescent SRHR? Those who say it's SDG 3, good health and well-being, by show of hands. No one. 2, 3. Okay, so a few hands come here. Those who say it's quality education, and for those who raise your hands, feel free to keep them up if you want. Both. Those who say it's quality education. Okay, a few more hands have come up. Those who say it's gender equality. Ooh. Wow. Okay, very impressive. Those who say it's SDG 8, decent work and economic growth. Many hands are still up. I want to get reflections from just one person on why they raised their hand for either one of these SDGs. In summary, less than a minute. I could also pick somebody, but I want to. We're talking about agency and choice. Anybody thinking strongly about why they raised their hand for any SDG? And all answers are correct. There's no wrong answer here. Wonderful, thank you.
Okay. So I think I'm loud enough. Right. So I raised my hand up for. Can you hear me?
No, we can hear you.
All right. So I raised my hand up for quality education as well as gender equality because for me, I believe when adolescent girls access and boys as well access quality education, they're able to make informed decisions about their sexual reproductive health and rights.
Wonderful. Thank you so much for sharing. The good news is we are all correct. All of these SDGs link strongly to the SRHR. Plus, they are all interconnected. And not just these SDGs, it's all the SDGs. And when we make progress on one SDG for adolescents, we make progress on the other. So they are all interconnected. And if there's one message that I want you all to take away after this 15-minute talk, is that yes, we have a great framework in the SDGs. We have great data on the SDGs. What's important is understanding what this data is telling us and being smart about how we use data to inform action when it counts. That's the key message. So for this session, I'm going to share a bit about the Girl Center's approach to evidence and adolescent well-being. I'll share a few case studies and insights on data, and then, of course, give a few takeaways at the end. As the Council and as Jim mentioned, we've elevated the adolescent growth agenda through generating evidence and convening partners and influencing policies for over 30 years across 30 countries. And our work is grounded in data, in action, and evidence. Our legacy is not just about generating evidence, it's about working with stakeholders like all of you in this room to make sure that this evidence is being synthesized and being utilized to inform policies and programs. As the Growth Center, we take this a step higher and we look at adolescents from a holistic perspective, and this was mentioned earlier on. Many people ask us, why not just look at one piece of their lives? Again, Hannah spoke a bit about this. think about yourself as an individual. Do you define your life by only, say, your work, or by your education, or by where you live only? I've had a few no's, which is true. We define ourselves based on different facets of our lives because we have different pieces of our lives that shape who we are and how we really move forward in this world. And it's the same for adolescents. If we look at their education, we need to think about how that connects to their health, think about how that connects to how they navigate the climate crisis, think about how that connects to whether they are free and free from sexual and gender-based violence, etc. So you have to look at different pieces of their lives when you talk about SDGs and when you talk about adolescents SRHR. And to ground this, I want to share the story of Malindi. Malindi is not her real name. This is for illustration purposes. Malindi is now 19 years old. She's from Zambia. When she was 12, she fell pregnant and she thought that her life was over because she feared that she would not go to school anymore. But a health worker in her village came to her and referred her to healthcare and the care that she needed. More importantly, her parents and her school allowed her to have the choice to make a decision on what she wanted. And because of that, she was able to go back to school. And also she believed that she would have a bright future, not just for herself, but for future generations. And what I love about Malindi's story is that, one, it's a positive story. I know we always talk about sob stories, but Malindi's story is positive. And two, there are so many SDGs that are addressed in just this one story. It's education, it's healthcare, it's about just and inclusive systems. It's about setting up an adolescent so that they can get decent work afterwards. It's also about future generations, one of the declarations that was made last year at the Summit of the Future. And again, this shows that when we make progress on one SDG target, we are really setting up adolescents for success. Adolescents, girls, even boys, those who would have otherwise been left behind. So every SDG progress accelerates progress for another SDG, and this is what the story of Malindi is telling us. Now I want to share data insights. And for this segment, I'll share 3 insights about data on adolescent SRHR and the SDGs. The first insight, and again, this was alluded to earlier, so I really like how our insights are interconnected. The first is that adolescent girls experience adolescence differently than boys. The data that you're seeing here is from Malawi from a few years back, but the context is more or less the same even up to now. 40% of girls experienced 3 major life events in their adolescence, compared to only 4% of boys. These 3 major life events, they left school, which means they didn't complete school, they engaged in sexual activity, and they got married. 40% of girls compared to only 4% of boys. This shows us that adolescent girls transition to adulthood faster than boys, not because they want to, but because of life circumstances. And again, Hannah pointed to this. It could be factors that are really beyond their control, either unpaid care work or household chores that they have to take up. Other aspects where they're in a community that has retrogressive social cultural norms, then they're married off early, they're not able to complete education, so many factors. And this shows us that whenever we think about policies and programs, we have to consider a gender lens. It's not just about one country, it's really about global indicators. If you look at the SDGs, no country is on track to achieve even half of the SDG targets related to adolescents SRHR. And I know Nina sort of touched on this. And think about it and just look at everyone in the room. I mean, we have researchers here, civil society, we have the UN, we have funders. Why is it that there's just 5 years left, 2030, no country is on track to achieve even half of the SDG targets related to adolescent SRHR? One of the barriers to this, it's as clear as daylight, as you can see. Because of gender gaps, we cannot make progress on the SDGs if we do not make progress on gender equality. Child marriage is still at an all-time high. I know we've made progress. If you look at other statistics, 40% of girls are not in education, not in employment, not in training, compared to just 10% of boys. HIV infections, in this case, HIV incidence amongst adolescents, 70% girls, 30% boys. Adolescent birth rates still high. So we really need to have a gender lens every time we look at our policies and programs and every time we look at data. Remember what I mentioned, we have great data. We need to be smart about how we use this data to inform and influence our action and investments. The second insight I want to share is on context. Whenever we look at data and the SDGs, because data in a vacuum can be misleading if you don't look beyond the aggregates. You have to literally tear apart data and understand the nuances beyond the aggregates for this data to make sense and for you to be able to use it well if we are to advance the SDGs. This is an example from the Dominican Republic. Contraceptive use amongst women of reproductive age is at 72%. If you look at that, you may think, well, they're doing pretty okay. But if you take just one segment of that population and look at adolescents, it's 33%. And this shows us if we're not intentional about disaggregating data and thinking about context, there is a risk of leaving behind adolescents. So every time we talk about SRHR, and even just thinking broadly to the SDGs, think about data. When you get data, think about the context, and again, be smart about how you use it. Another example, still on context, Kenya, my country, teenage pregnancy, the average rate at national level is 15%. And you may think, yeah, we are doing well as a country. However, if you go further and look at subnational level and the counties, some counties report as high as 50% teenage pregnancy rates, 1 in every 2 girls in some of the counties. Other counties are doing really well, 8%, their rates have declined over the years. Again, this shows that an adolescent girl in one community can be having a completely different experience from an adolescent girl in a different community. It could be that they're in communities where they're married off early, and I've seen this in one of the pastoral counties where they're navigating the climate crisis, they're experiencing long periods of drought, so they have to marry off their girls as their only economic source of income, which is so sad. So such counties like Samburu County are reporting 50% teenage pregnancy rates because most of them are married off early. Other counties, like in the informal settlements, we still have a lot of transactional sex, so teenage pregnancy is high. Counties that are doing well, if you look at the girls in those regions, they have a supportive environment in the healthcare systems. Their communities and families are doing well socioeconomically, so it's a whole system that supports the girls. And this shows us that policies need to take into consideration local context. We need to meet girls where they are. So we shouldn't program by just looking at national level data or regional level data or global data, but we really need to look at subnational context, community context, and acknowledge the different lived realities of girls. The third and last insight that I want to share is that we need a whole systems approach to adolescent SRHR. And we've seen this from looking at the data from Kenya, looking at the data from Dominican Republic. We cannot have a one-size-fits-all approach when it comes to policies and programs for adolescent SRHR. And we want to show you a short video of one of the programs that has been implemented by the Council, Abriendo Oportunidades in Guatemala. The Council has been implementing this program for several years now. Just take a listen. It's less than 2 minutes.
Life for indigenous Guatemalans continues to be marked by linguistic marginalization, discrimination, and significant challenges in accessing essential health and education services. For indigenous girls, the isolation, poverty, and social exclusion create barriers that are difficult to overcome. Beginning in the early 2000s, the Population Council conducted seminal research on the situation for indigenous adolescent girls in Guatemala. We found that they were experiencing a quadruple disadvantage due to age, gender, ethnicity, and geography. The Population Council Guatemala recognized the potential of indigenous girls and women as mentors and agents of change. In 2004, we introduced a new initiative in 4 geographic areas of Guatemala, Abriendo Oportunidades, also known as AO. This community-based intervention focused on growing the social, health, and economic assets and capabilities of adolescent girls. The program was novel, evidence-based, gender transformative, and designed with and for girls. In community-based girls' clubs, girls learned practical life skills, built confidence, and took on leadership roles, building their social capital and networks. Data showed that AO was having a positive impact on mentors and participants from the start.
That is the AO program, and what we all love about this particular model, and it's been implemented across so many other initiatives by the council, is that it takes on a multidimensional approach to adolescent empowerment, including SRHR. When it comes to the SDGs, we need to think of this in the same lens. Girls need much more than access. They need systems to work for them. So even for the SDGs, it shouldn't be abstract. It's about that one clinic appointment for a girl that went really well, and she found a health worker who is skilled, who is able to give her the services that she needs in privacy. It's about having commodities in that health facility. It's about having countries that are able to finance and have good governance structures. We've seen just a few days ago, Rwanda, they've lowered their age for consent for contraception up to 15 years. So that means more girls will have access to contraceptives. So when you think about the SDGs, SRHR, it's about systems working for girls. It's about having communities that support them, community norms that enable them to thrive. It's about redefining masculinity. It's so many systems. So we need that whole systems approach whenever we talk about SRHR, and also when we think about the SDGs, ensuring that we have all these facets of a system working for girls. I want to conclude by sharing 2 case studies. One which Jim has already talked about, the Adolescent Girls Initiative Kenya, AGIK. This initiative has been implemented for over a decade in 2 counties in Kenya, reaching over 5,000 girls aged between 10 to 14. It's critical to look at that age group because these are the very young adolescents. This is the age group where we can have most impact and really set them up for success when we invest within that age group, 10 to 14. AGIK had a number of interventions: cash plus transfers to their households, community empowerment and working with communities to change norms. There was financial life skills education, financial literacy, just to ensure that girls were able to get skills, which will then enable them to have a brighter future. And the impact has been tremendous. Reduced rates of child marriage, reduced rates of teenage pregnancies. We had more girls staying in schools. But what's really powerful about AGIK is that it was taken up by the government, as Dee mentioned. The government of Wajir County, which is one of the counties where AGIK is being implemented, is actually budgeting for cash transfers for households so that then they're able to enable their girls to go to school. They don't have to think about marrying them off. The AGIK model is also being used to design an entire nationwide cash plus transfer program with the Council, the World Bank, the UN, and many other stakeholders. So for us, it's not just about generating evidence and informing programs and policies. It's about ensuring that we work with stakeholders to sustain this progress beyond the work of the Council. So this is one of the models that we are implementing. And the last one is from Bangladesh. It's called Balika, almost the same as AGIK. This was a randomized controlled trial reaching over 9,000 girls aged between 12 to 18, and there were 3 kinds of interventions on education, livelihoods, gender and rights, and of course there was the control arm. Great outcomes from this program, just like all others, and we had interventions around mentoring girls. So this is almost similar to AO as well. We had interventions on life skills, so girls were being taught, about photography and other skills that will set them up for success, community engagement, etc. The outcomes is just listed one there that we saw reduction in child marriage by 25% to 30%. Balika has also been scaled up in Bangladesh with the same positive results. As I conclude, the SDGs, we have a great framework. We can talk about the SDGs the whole day. There's a lot of data on adolescent SRHR. What's important is really understanding what data is telling you and being smart about how you use it to inform investment and also to sustain progress. So always remember that girls' lives are multifaceted, that we need to plan and have investments that have a gender lens. We need to remember that data is critical, but you always have to consider context whenever you're looking at data. Look at data beyond the aggregates. And lastly, we need a whole systems approach for the work that we are doing. So we have to advance adolescent SRHR and the SDGs. So we know what works. It's time for us to scale it and sustain it, and most importantly, to work collaboratively together. Thank you very much. There's a lot of information on the council sites, on our knowledge commons. We have also data sets, hundreds of data sets. For example, for the Girl Center, these are hosted within the Adolescent Atlas for Action. That's on our website as well. Feel free to interact with that data. You can also subscribe to our newsletter to always get updates on the different initiatives that we have as the Girl Center and as the council in general. Thank you very much, and I'll hand it over back to Karin.
Thank you so much. That was crystal clear, and also the summary, so I'm not going to summarize. It is clear that adolescent girls are left behind. Data tells it's clear that it speaks this clear language. Data is there. You see evidence of what's working and what's not, what's missing, and what needs to be done to ensure that young girls' lives matter, that they're not discriminated, that they're not excluded. And, it's so evident looking into data and seeing how is it that no country in the world have managed to achieve the SDGs. No country in the world have managed to achieve gender equality for all. And how that's driving change. How can we create societies that will be inclusive, that will enable people and young people, adolescent girls, to complete their education, to live healthy lives, and also to participate in labor and in workforce. If they can't have that progress, that enabling environment, then how can we then reach a sustainable development for all? So crystal clear that the steps that needs to be taken. It's really important to look at the data and what's working and to understand the context around it, but mostly also to understand why is it that adolescent girls continue to be discriminated? How can we change the systems around that? How can we change the structures around that? I'm starting to think that the SDGs, we've been hearing that certain less convinced member states questioning if the SDGs are important. Maybe we should tell them a new acronym that SDGs might mean sustainable development for girls. Sustaining development for and by girls, to be part of the solution, to point to progress. It's so crucial, and thank you so much for sharing your expertise and the concrete evidence. I am delighted to now also open up a little bit of conversation, reflection on how can we make use of data? How can we make sure that we enable environment for young people and for adolescent girls and in all their diversity to move forward? I also want to point you to that, of course, please do read more. You see a little bit of leaflets from the Girl Center, and you can scan the codes. SheDecides, we also made youth research SRHR digest, so please feel free to scan. We have used lots of population councils research, so we try to digest it so it's useful for you in terms of informing your policymakers and decision makers on making the right choice in investing in adolescent SRHR. And we know the outcome, we know the benefits, and we know the needs. And now we need action. And speaking about action, I was wondering if I can now get help from Marielle. And if I may invite Lauren, would you mind sharing? We've heard new investment from Gates Foundation in investing in adolescent and youth SRHR, in supporting health systems, in stepping up for global health, which is amazing these times when we see pushback and rollbacks on these particular issues. Would you mind sharing a couple of thoughts from your side?
No, not at all. Can you all hear me properly? Yeah, okay, good. Just really quickly, I'm curious to know how many people in here feel like they've benefited from access to contraceptives at some point in their life. Okay, great, cool, me too. Definitely would not be standing here today if not. And so I think that when I think about the role that contraceptives have played in, for me, bringing me to this point, and I think many of you, it's really hard to imagine that you could be here at Ongo Week without it. And so for the foundation, a lot of our work, and for those of you who are familiar, probably understand that we do a lot of investing in family planning. And I'm relieved that Evalin so kindly set me up for some of the investments I wanted to talk about today, because I do think they emulate some of what you heard in the data. But of course, that data gave me a lot to think about as I head back to my desk at the end of this week. So the first thing I wanted to talk a little bit about is our investment with Sky Girls. Another survey. Has anyone heard of Sky Girls? Oh, okay. So now we have some education. That's great. A lot fewer hands there. So Sky Girls is one of my grantees. If you have your phone on you, I won't be mad if you look them up right now. They're pretty fantastic. And what it is a program that educates girls and young women in school age through about 20 on the different forms of contraceptive access, contraceptives that are available to them, about consent and what healthy relationships look like, and the kind of comprehensive health across not just their physical health, but their social health as well, and building those life skills. And so when I think about why that kind of investing is so important, it really positions women, young women, girls, not as the proxies, but as our partners, and not as beneficiaries, but as leaders, because they're creating the content and they're developing the community that's going to help bring girls through. And when I think about the program and how maybe some of us could connect to it, is they have a really incredible part of it that is about big sisters. And I'm an eldest sister. I think I kind of give that energy, but they have this program where they connect young women with kind of big sisters to help guide them through adolescence and the different decision points that you have, whether that be related to relationships, to intimacy, to contraception. And so for me, that was something that, as I thought about not just the element of education and awareness, but of having that community. And I did not have a big sister. And I think so often of all the ways that I could have benefited from that kind of support. And so it's easy to imagine, right, how a program like this could be so beneficial for those young girls, and how they're helping each other and really being the community that they need in order to connect with the resources that are going to help them live their best life. And so that's one that I wanted to talk a little bit about, to emulate or, illustrate for you all what we're thinking about, how we're approaching youth engagement. The other one, and I see one of my grantees in the room over here, is FP23. So FP23 does some really fantastic work on youth engagement, and having youth points who are leading on not only bringing youth into the policymaking process around family planning, but making sure that they're engaged in the accountability mechanisms, and that they're engaged in telling their story and informing the path forward when it comes to contraception, and all the things that all the work we have left to do when it comes to innovation, to access, to affordability, and to shifting some of the cultural norms that would make contraception more accessible. And so FP 2030 is another fantastic organization that is doing all sorts of work, not just in the youth leadership sense, but in the policymaking sense, and in the social norms, and in bringing all of those pieces together. And so if you haven't already looked at FP 2030 and specifically what they're doing around youth, to make it possible for youth to connect with these resources and their policymakers about why these resources are important from a national budget and priority perspective, I highly encourage you to connect to them. And they're wearing red, so they got the memo from you, I'm sure. And so those were just two investments. And I think I could have gotten up here and given you some lines about how we think about youth engagement and SRHR, but I think it's a lot more powerful for you to actually understand some of the investments that we have made, and where we're thinking about taking them. And so as you look ahead and think about your own investments, I do hope that you'll take to heart this idea of partners, not proxies, of leaders, not beneficiaries, and really investing in the adolescent experience. And I think being, the big sister or the big brother that you wanted to have that was going to connect you to those resources. And I think so many of our grantees at the foundation are doing this really well. And I only had the opportunity and the time to highlight 2 of them here. So thank you. I really do appreciate the time to share about it. And I hope that I met your expectations.
Thank you so much, Lauren. Any questions? It matters to make those investments. We know what change will happen when those investments are made, but we also know what will happen when youth leaders lead, when we put young people at the center of course, being the expert themselves on what's needed and what needs to be done, and guiding the policies and programs and action that needs to happen for young people. And on that note, I was wondering if we could hear from May, possibly, if you would like to share a little bit of your expertise from Vietnam. Over to you.
Hello, everyone. So I'm from Vietnam and thank you for the opportunity. So I really welcome the emphasis on the data and evidence. So it shows us that achieving SDGs and ensuring inclusive SRHR is closely connected. And the data also remind us that progress is not uniform and context matters. For example, in Vietnam and Southeast Asia, while there have been advances in the youth health and education, the young people still face barriers in accessing comprehensive education and youth-friendly HR services. And for that, the barriers even sharpen for the marginalized group, people living in rural areas, people living with disability, young women and adolescent girls in all their diversity, LGBTQI+ people, among others. So, for instance, LGBTQ+ women and individuals are rarely considered in SRHR initiative. And so that it means that their experiences remain invisible in both discussion and practice. What I want to stress and build on what has been shared is if we want to make progress, we need approaches that are evidence-based, but the evidence also needs to be grounded in the live reality and experiences of young people. We need to listening to their story, engaging them as equal partners, and investing in grassroots and youth-led movements, and also designing programs that reflect the life experiences of young people. So, thank you so much.
Thank you, super clear. Young people know what's missing and what they want, and they do have solutions. And also on that note, I was wondering if you would like to share also from your end when it comes from Nepal, if you'd like to share a couple of reflections, and leave it over to you.
Hello, everyone. My name is Puspa Joshi, and I'm from Nepal. I'm associated with an organization called NOSHAD, which works in the field of sexual and reproductive health rights. And I'm also a WASO fellow. And I'm really glad to be in the program co-organized by SheDecides, as I was also one of the part of SheDecides a few years back. So talking about the context of Nepal, as you all know that Nepal is situated between big power India and China, and we have 300 million population. But despite being a small population, we have a great diversity in terms of language, culture, ethnicity, and other factors. And so when we talk about young people, we also have a big diversity. And when we talk about data, we do have data, but the problem is that data is often overlooked when making policies, because when making policies, the policymakers tend to, impose their social norms and, those patriarchal values despite having data. For example, I want to give an example. We have a law that criminalizes adolescent sexuality. So within our penal code. The section 2219 criminalizes sexual relationship between two adolescents, even though they are of same age. So if the girl is below the 18 years of age, and if she engages with another, let's say, boy who is also below the age of 18, then the boy is criminalized as a rapist. So even if the relationship is consensual and non-exploitative, it is criminalized. So our national data has itself showed that a lot of young people engages in sexual activity below the age of 18. But the government often they have overlooked this data, and they themselves, impose their problematic social values while making policies. And this is something that we have been struggling with, and we have been fighting for in our country. And we have been generating alternative data with more stories and lived realities of young people. And reflecting on the importance of context specificity that we have been talking about, in Nepal, the key SRHR issues young people face are deeply shaped by our laws, social norms, and education system. For example, when we talk about comprehensive sexuality education, yes, the comprehensive sexuality education has been institutionalized by the Ministry of Education, but it has been made optional for for secondary level. It is only a compulsory subject up to grade 8. But after that, it's optional. And when we talk about comprehensive sexuality education, it is only limited within the formal education system. And we tend to forget the fact that a lot of young people drop out from the school, and the comprehensive sexuality education is not being able to, reach out to those young people who have already dropped out of the school system. So this is also something we have been fighting for and trying to ensure. And
this is really rich, and I encourage also to go into depth in terms of all the challenges in terms of having access to enabling to. But on that note, I wanted to connect to also another question around you mentioning what is that we can do to make government listen to you, to listen to what young people are asking for, to point to the data. We also have other youth ambassadors in the room who are also working on that. Would you mind wrapping up, and then we will hand over to see what could be done to make governments and policymakers to listen to young people?
Yeah, it's absolutely very, very important, but at the same time, it's very challenging. That's why, we young people had to revolt against our government, and we even talk on the government because, they were not listening to us. So we had to take that form, and it was necessary. But I'm hopeful that, the government will collaborate with us. And for that, we definitely need to, we collectively, including young people, and as we talked about intergenerational partnership and international community is also very important to pressure government. And I think it's very difficult, but at the same time, it's possible if you all come together and pressure our government and help each other. Even international communities' help is very, very crucial.
Yes.
Yeah, and I'd like to wrap up.
Thank you. And that comes to the point on global solidarity. What is that we can do in between countries? What can we do within international development cooperation? I was wondering if I could hand over the final sort of reflection from the audience from a Danish point of view. You've been working in the global fora in terms of enabling youth voices, having a platform within the Danish government. Would you like to share how can that be done? How can Denmark have a conversation with the Nepalese government? And what are you doing as youth ambassadors within your government? How do you make young people's voices heard and research seen?
Okay. So we're the Danish Youth Developers for Gender Equality and Research. And our purpose is to spread the word of Danish youth, but we also want to represent the global youth, and especially those who are not represented as much and who are more vulnerable, and voices also needs to be heard. And in that regard, the only thing we can rely on is really data, since we are not able to speak with every young person in this world. So data is like our most important reliance when we are speaking for young people. is what we have, is what we can say. And in Denmark, we have a very strong connection between the civil society and the ruling and especially the Family Planning Association, who are making comprehensive sexual education and other services such as prevention and other very important SRHR related services. And they also have a very rich amount of data that we personally are using, but also the Danish government are using when they're implementing new laws. I don't know if you have anything to add.
Yeah, just to make it short as well. So how do we approach the governments and what's the best way to do it? And I would like to echo the words from my fellow SRHR advocate from Vietnam. There's two ways to do it. First of all, the grassroots movement is essential because if we want to have an influence on governments, it has to come from the bottom up because in the end, the governments look at the people who vote. And if the people that vote want to go in one direction, then the governments at some point needs to follow that. You can see it at the whole climate narrative that was created several years ago, and look at where every government now is talking about the climate, basically. And another way that you can approach the government is also within the government. And the key word here is translation, because data is good, but if you don't translate it into words that the Ministry of Finance understands, then there's no money. And if there's no money, then there's no resource to do all these great initiatives that we see up here. So we also need to ensure that all the data that we have, that we translate it into words that is attractive for the Ministry of Finance in the different countries. And there are social aspects and a lot of different aspects that we need to think about when we translate the data that we have. So 2 words, grassroots movement and making it hard for the Ministry of Finance.
Thank you so much. That's excellent wrap up. I would like to give all the big round of applause. Will not achieve the SDGs without your expertise, with the leadership of young people, with the data that we need to inform policies, and also to build policies together with young people, firmly rooted in evidence. Of course, we have the data, you pointed to it, we know what's working, young people know what's missing. Listen, learn, read, connect. We're delighted to work with you. Please feel free to connect after this session. This is just the beginning. We work together, we stand up together to make sure that the right policies are in place that serve and put the focus on what young people say that they need. Thank you so much for coming. Thank you.